Aloha everyone, I'm Dr. Tom from Klondike Total Health Center. Today we're talking about the common causes of sciatica. As you may know, sciatica can vary from person to person. Symptoms can be different and variable. The reason is because the cause of the sciatica might be different from person to person. Again, the really important factor here is for you to understand what is causing your sciatica. Therefore, we can understand how to fix or correct your sciatica pain. Let's start. Disc herniations are a very leading cause of sciatica, where we have direct compression of the spinal nerve roots from the disc or the disc herniation. Degenerative disc disease. Now we have a chronic condition of that disc injury, whereby we have degenerative conditions, herniations of the disc that can further compromise or compress the spinal nerve roots. Next, osteoarthritis, degenerative joint disease. Now we can get scar tissue, adhesions, and bone spurs around the joint and disc and bones, all together further compromise or compressing the spinal nerve roots. Next, scar tissue formation, adhesions at the spinal level or extraspinal around the hip and pelvis and gluteal regions, from sprain strain injuries to direct compression or contusion injuries, slips and falls, all can contribute to sciatic nerve dysfunction or compression. Next, spondylolisthesis and spondylosis, another leading cause. These are usually chronic causes, but may be acute as well. Again, a shift in alignment of the vertebrae, thus compromising the compression or health of that nerve root as well. Next, sacroiliac joint dysfunction. Now we have a dysfunction of the joint of the hips and pelvis, as well, irritating the nerve roots or sciatic nerve, and or simply referring pain into a similar pain distribution, although the cause is somewhat different. Next, piriformis syndrome, another leading cause. Now we can have spasm of the piriformis, or what we call the deep gluteal muscles. We're going to have inflammation, swelling of those muscles and tendons as well. Again, further compressing or irritating that sciatic nerve. Sprain strain injuries. Again, as we discussed, injuries, acute and chronic injuries to the lumbar pelvic hip complex, whether it's a slip and fall, a direct compression, a contusion, a twisting, bending, lifting injury, all can contribute to sciatic pain. Next, a complex of symptoms that we can call the subluxation complex. Subluxations are really a complex of all those disorders we just talked about. You can have two or more of those all at the same time. Again, we call those a subluxation complex of disorders too. Again, there's some less common conditions of sciatica that we need to consider in the differential diagnosis. This can range from cyst formations, tumors, infections. Again, these are organic causes. They're not common, but they're always included in our differential diagnosis, part of our physical exam and health history. Again, now you can see sciatica can be caused by a wide range of conditions and give you some different symptoms that are variable from person to person. The key take-home message with this is to understand first what is causing your sciatica. Therefore, we can understand how to treat your sciatica and correct it too. Again, the earlier we detect your sciatica, the easier it is to correct. Again, I'm Dr. Tom from Klondike Total Health Center, your one-stop healthcare shop. Thank you. Aloha, mahalo.